Dr. Ryan here. I'm a board certified specialist physician. Thank you for joining me in our 63rd episode in the OSCE series. We are talking about paradoxical embolism in atrial septal defect. If you haven't yet subscribed to my channel, I strongly encourage you to do just that. So this is a typical illness script for atrial septal defect. Okay, 40-year-old patient with long-standing history of fatigue, exercise or diminished exercise tolerance, and episodic palpitations, present with an acute onset of right hand weakness and dysarthria, a normal jugular venous pressure on examination, no lower extremity edema, and this is the buzzword, wide fixed split of the second heart sound when standing. Mid-systolic ejection murmur at the second left interspace. His ECG shows you sinus rhythm. Chest X-ray shows you right atrial enlargement. What's happening, guys? This particular constellation of clinical signs and symptoms. What's the diagnosis here? Well, it is inevitably a paradoxical embolism on account of atrial septal defect. Let's dissect this a bit. So the patient essentially presented with a stroke in the territory of the middle cerebral artery, which occurred as a result of atrial fibrillation caused by ASD. So I know in the vignette I said that there was sinus rhythm, but it could be paroxysmal AF, right? Physical exam and chest X-ray gives clues as to the underlying ASD process. Now, prior to development of severe right ventricular overload and high pulmonary flow rates that cause the pulmonary hypertension, the shunting of blood through the ASD is left to right, left to right, and the second heart sound is fixed. So this fixed splitting and widely split second heart sound, and murmur of TR, which is tricuspid regurgitation, is audible. The right atrium and the right ventricle will distend on account of volume overload. And with time, what happens is pulmonary hypertension is going to develop, and that left to right shunt now becomes reversed to a right to left shunt, something we call Eisenmenger syndrome. Right? Eisenmenger syndrome, the S2 split disappears. This pulmonary component of the second heart sound, the P2, gets louder, and the murmur of tricuspid regurgitation resolves. And eventually, your situation is that of clubbing and cyanosis, which will develop. And the right atrial enlargement on the chest X-ray and the stroke tell us that this patient's shunt physiology is now right to left, although the S2 findings haven't yet changed clinically. Right? Very important to note the buzzword, fixed splitting, wide fixed splitting of the second heart sound should point you towards an atrial septal defect, right? And other ECG findings consistent with the atrial septal defect is you may have first degree atrioventricular block, right axis deviation with the RSR prime or RSR pattern in V1, which is consistent with a right bundle brush block because of the increased volume load imposed on the right ventricle. So how are we going to diagnose paradoxical embolism on account of ASD? So clinical and Doppler echo with or without augmented saline so-called bubble echo study, which will demonstrate a right to left shunt, right, which is the so-called bubbles are present, it will show us the shunt and the bubbles are present on the right side of the heart coming from the left, and then you might have reversal of that, the Eisenmenger physiology. Treatment depends on extent of the shunt. Ideally, cardiothoracics should get involved and offer surgery for the larger shunts. So this, of course, another beautiful slide taken from the Calgary Guide, showing us the pathogenesis and clinical findings in the atrial septal defect. So once again, certain genetic syndromes like Noonan and Down syndrome and certain genetic mutations could be spontaneous as well, result in the abnormal formation of the atrial septum, and that's an atrial septal defect, which is essentially an abnormal connection between the left and right atria. So following birth, we know that the lungs fill with air and resistance to blood flow in the lung vasculature decreases. The pressure within the right ventricle and the right atrium decrease. The left atrial pressure exceeds right atrial pressure, and then blood passes from the left to the right through the ASD, which is left to right shunt. Essentially, we have increased blood through the right heart. And from this point, there's three kind of stratifications or branch points. Right sided heart dilation, which is the enlargement of the right ventricle. As a result, you have right ventricular heave, which will give rise to a visible or palpable chest wall impulse around the sternum. Then enlarged ventricle cannot pump blood effectively. This leads to congestive heart failure and will lead to reduced exercise capacity, fatigue, failure to thrive, increased backup of blood in the lungs with increased hydrostatic pressure in the lung vasculature, leading to pulmonary edema, which leads to dyspnea and increased propensity to respiratory tract infection. There's also an increase in right atrial wall stress, damage to normal conduction of electrical signal from the atrial to the ventricles, which is responsible for the ECG changes that we have, the prolonged PR and QRS intervals, the right bundle branch block, the right axis deviation, and the atrial arrhythmias, which may lead to palpitations, right, on account of atrial fibrillation or flutter. Right, and then of course the increased blood flow through the tricuspid valve gives us the mid-diastolic murmur. An increased blood flow through the pulmonary valves and pulmonary vasculature, right, will eventually lead to the fixed splitting of the second heart sound, right, and the mid-systolic ejection murmur and the development of pulmonary hypertension. Okay, my friends, Paul admonishes us in the book of 1 Corinthians chapter 6, verse 18 to 20. He says, flee from sexual immorality. Now, the word flee is a very strong word. It doesn't mean simply walk. It means you run away, you kick down, right? Flee from sexual immorality, because all other sins a man commits are outside his body. But he who sins sexually sins against his own body. Now, do you not know that your body is a temple for the Holy Spirit who dwells in you, whom you have from God, that you are not your own? You were bought at a price. Therefore, honor God with your body. The book of Romans chapter 12, verse 2 says, offer your bodies as living sacrifices unto the Lord, holy and pleasing. That is your spiritual act of worship. The Holy Spirit dwells in our body. When we sin sexually, we sin against the dwelling place for the Holy Spirit. I pray that we will keep ourselves from lust and run away by the power of the Holy Spirit. Here are my references. I'll see you soon. God bless.